YouTube. In today's video, we're going to talk about pleural friction rub, an adventitious lung sound that can be heard upon lung auscultation. First, we're going to get into what pleural friction rub is, as well as how it sounds. We're also going to discuss some instances in which a patient would experience pleural friction rub. And lastly, we're going to go over a few common nursing interventions that will help the patient. So let's get started. So let's start by discussing what pleural friction rub is. As you may know, the lungs have two layers, the visceral layer and the parietal layer. When these two layers of the lungs become inflamed or lose lubrication, these layers become roughened and begin to rub against one another, causing something known as pleural friction rub. You can hear this sound with your stethoscope during movement of the chest wall. The sound of pleural friction rub is often described as a creaking or grating noise. Some people have also described it as the sound of walking on fresh snow. Now, pleural friction rub is going to cause your patient excruciating pain, especially when they inhale. So, since it's going to be very uncomfortable for the patient to breathe, this is going to cause the patient to have very shallow respirations. And remember, when a person has shallow breathing, a little bit of oxygen is entering the body and carbon dioxide is building up. And this could lead to other complications, such as atelectasis, hypoxemia, and hypercapnia. Now let's go over a few circumstances in which a patient would experience pleural friction rub, starting with pleurisy. Pleurisy, also known as pleuritis, is when the parietal and visceral layers of the lung become inflamed and swollen. And as we just stated in the last slide, pleural friction rub is caused by inflammation of the lungs or a loss of lubrication. So when this person inhales, the inflamed pleurae will rub together, causing them to feel severe sharp pain. Now, pleural friction rub is only heard early in pleurisy. The reason why is because later in pleurisy, fibrin and lymph will cause exudate to build up in the lung. As this fluid accumulates, the pleural friction rub will begin to disappear. Pleural friction rub can also be caused by something called pleural effusion. This is when there is an abnormal collection of fluid between the visceral layer and the parietal layer. Now, pleural effusion is usually a complication caused by something else, such as lung cancer, TB, pulmonary embolism, or CHF, just to name a few. When auscultating the lungs, the nurse may hear pleural friction rub as well as diminished breath sounds. A lung abscess, which is a localized area of pus forming within the lung parenchyma, can also cause pleural friction rub. Tissue becomes necrotic as the lung abscess grows bigger. The lung abscess will later collapse and create a cavity or space. The infection from the collapsed abscess can then spread to the bronchi and the pleural cavity of the lung. When the area of the abscess is auscultated, the nurse may hear dull or absent breath sounds with possible pleural friction rub. Okay guys, so remember we said earlier that patients experiencing pleural friction rub feel pain when they breathe. This causes them to take very shallow breaths in hopes to avoid the pain. Not only is this going to diagnose them with ineffective breathing pattern, but they're also at high risk for oxygenation issues. So we would diagnose this patient with impaired gas exchange as well. Now let's go over some common, but not all, nursing interventions for the patient experiencing pleural friction rub. We are certainly going to want to assess and monitor the patient's lung sounds, respiratory rate, and depth. Not only will this help us to monitor the effectiveness of treatment, but this will also help us to establish a baseline. We're also going to want to monitor oxygen saturation levels because a person with shallow breathing isn't taking in as much oxygen as they should. Carbon dioxide can build up due to shallow breathing related to pain, so we also want to monitor this patient's blood gas values. We want to monitor for changes in level of consciousness. As this patient takes shallow breaths, this could cause an insufficient amount of oxygen to reach the brain. Restlessness, confusion, or irritability can all be early indicators of a change in level of consciousness. Also, evaluate skin color, temperature, and cap refill. Be aware that a lack of oxygen can cause a blue coloring of the lips, tongue, and fingers. Based on your findings, you would administer oxygen as needed. We could also elevate the head of the patient's bed to a semi-Fowler's position just to increase the amount of air taken in with each breath. Nursing intervention should be specific to the patient and may vary depending on the underlying cause. If the patient is experiencing pleural friction rub due to an underlying infection, we want to administer prescribed antibiotics and monitor for adverse effects. Common adverse effects of ABT therapy may be skin rash, soft stools, diarrhea, upset stomach, nausea, and vaginal infections, just to name a few. And remember we said that pleural friction rub is going to cause the patient excruciating pain, especially when they breathe. So we're going to want to administer those prescribed analgesics just to help ease the pain. Usually a patient experiencing pleural friction rub is prescribed an NSAID. A common one is Indocin. Indocin is used to treat pleuritic chest pain, especially pleuritic chest pain that is caused by pleurisy. In addition to pain medication, we could also administer hot or cold applications just to provide topical comfort. Now, as we said before, pleural friction rubs are painful for the patient, but if your patient is experiencing pleural friction rub due to a respiratory infection, other symptoms such as coughing and sneezing may make the pain worse. Teach your patients to splint their chest wall when they cough. They could do this by turning to their affected side or by covering their chest with their hands or a pillow when they cough. And lastly, but certainly not least, we want to provide emotional support. Because whether it be the pain, the inability to breathe properly, or the underlying condition causing the pleural friction rub, this can be a very frightening experience for the person you're taking care of. Alright everyone, that brings this video about pleural friction rub to an end. Please be sure to like, comment, share, and subscribe. Remember to never give up, and as always, thanks for watching.